Metabolic Boost program. It's a 6-week program. We're going to have weekly Zoom calls, Facebook group. So if you don't have the link for the Facebook group, let me know and I can get that to you. You can send me an email or something like that, or give me a call. And then we also have lipostat, lipomino injections, which are optional, but they are metabolic boost injections. So real excited that you're here. Thanks so much for coming. So have you ever tried to lose weight? So, and has it worked? So losing weight, oftentimes people think that you need to count your calories, restrict your calories, exercise more. What we're finding is this is not the best way to lose weight. Eating less doesn't work. And actually when you eat less, you're getting less calories. And so your metabolic rate is gonna go down. And so our body is always trying to maintain homeostasis, trying to maintain equilibrium. And so if we eat less, we're gonna actually, the body doesn't wanna lose weight on its own. And so it's gonna lower the basal metabolic rate so that way you can maintain your weight. So you have like a thermostatic, set point, homeostatic set point. So when you cut calories, you get hungry, right? And so we don't want you to be hungry. When you get hungry, you get hangry, like, get irritable. You also get tired. If you're not getting enough calories, you'll get a little bit tired. Your basal metabolic rate will go down. So your body is always trying to balance, calories that you're taking in and how much you're burning in order to maintain that basal metabolic rate, that homeostasis. If you're eating less, it's going to burn less. And if you eat more, it's going to burn more. You'll see, for short periods of time, it's going to do that. And if you're eating less, you're going to get tired. But after time, if you're eating a lot over time, you will gain weight. And because the hypothalamic set point is going to get raised up. So the calorie deception. So I love this slide because when I first heard this, I thought, gee, this just kind of changed my paradigm. Like there's no actual calorie receptor in the body. So cutting calories doesn't work. The body doesn't recognize calories. It's not a calorie receptor. It's not like, oh, you have 100 calories. Great, let me work with that. So that's not working. So 100 calories of sugar does not equal 100 calories of olive oil. And the body recognizes this very different. And it looks at this very differently physiologically because the body is responding to hormones. So sugar is very different than protein, which is very different from fat. Different body response to these different things. And so different hormones are being released. The main hormone for weight is insulin. And so you're going to secrete more insulin for carbohydrate than you are for fat. So a brownie is not the same as olive oil. Carbohydrates secrete the most insulin. So those are considered, Dr. Jason Fung says fattening carbohydrates, kind of trying to get the point across that these things are more fattening because they secrete more insulin. So flour, pasta, a lot of the processed foods, potatoes are going to have a big insulin response. Protein, gram for gram has a much less insulin response, and fat has no insulin response. And what you're going to see here is that insulin is really what's making us fat. So the more insulin you have, the more storage you're going to have. So again, the body doesn't care about the calorie. It only cares about the types of food that you're eating. And that's how it's responding to your foods, is through hormones. So being overweight isn't really a caloric imbalance. It's a hormonal imbalance. And so there's different hormones. Insulin is number one. Different hormones get released when we eat: ghrelin, leptins, adipokines. Is all types of hormones that are trying to regulate your weight. So obesity is not caused by your genes. I think, I come from a very heavy family. And so my uncle, like 300, 400 pounds, everyone in my mom's generation, her siblings were all overweight. And then people in my family, my direct family, people are overweight. And so it's really not a genetic thing. We can impact our weight through our diet and lifestyle. And it's really not a lack of willpower either. What we found is that, we've been trained the wrong way. And so, back in the day, back in the 70s and the 80s, they were saying, eat 6 times a day. The food pyramid changed, the carbohydrates, you eat lots of carbs, don't eat fat, So the information that we've been given is changed. And when we eat the wrong way, different hormones get secreted, and they cause us to want to eat more. It's hard to ignore being hungry, right? So when the hunger hormone called ghrelin gets increased, we want to, protect ourselves. We don't want to die from hunger. And so it causes us to want to eat more. And so here's just a food for thought about sugar. So sugar is very dangerous. I read the other day 3 words to accurately describe processed sugar is number 1 is that it's toxic. So all processed sugar is toxic. I'm not talking about honey, but all the processed foods are toxic, very addicting, right? So who can eat just one cookie? I know I can't eat one cookie. I could eat a whole bag of cookies. It's very addicting. And then it is deadly. Diabetes is one of the deadliest diseases. It's, killed more people than a war, it's killed more people, it's just killed way more people than any other thing that's sugar. So it is very deadly. It's very addicting, and it's hard to stop. And we really need to, there are ways to stop, and we're going to train ourselves to be better. So insulin is the main hormone that we're talking about. Insulin is a hormone. It's released from the pancreas. It's always present in the body, unless you're a type 1 diabetic. Type 1 diabetic means that you're low in, you don't have insulin, so we need to give you insulin. Insulin's main effect is to lower blood glucose. And so if you don't have insulin, like a type 1 diabetic, you're going to be very thin. You have to, insulin is what makes you fat. So you can take a type 1 diabetic before they get diagnosed. They're usually very thin because their body's not able to take the insulin, put the sugar into the cell to gain weight. When we give them insulin, we're able to get them to gain weight. So insulin is what opens the door to allow the sugar to get in. Insulin is also an anabolic hormone. It's for storage of fat, and also building. So building for proteins and things like that. So it does help with muscle building. It helps with fat building. And when you have too much insulin, it causes diminishing returns. So the more insulin you have, the less effective it's going to be, which is why we call it insulin resistance. So every cell in the body has an insulin receptor. So the muscles have insulin receptors, the kidneys, the brain. The brain does need a lot of sugar to work. And the brain can become insulin resistant, and they actually call that type 3 diabetes, and that leads to Alzheimer's disease. So only so much glucose can get put into a fat cell. So, the insulin is being raised up every time we eat sugar, and the more glucose you have, the more insulin, but the fat cell can only take so much. And so then it starts to spill over, and it has to go into other organs and cause more inflammation and degeneration. We do need rest periods. So we've been taught to eat 6 times a day. Don't get hungry, eat. This doesn't work because when you eat, the sugar goes up, the insulin goes up, and then it causes fat storage. Well, if you want to lose fat, or you need time to not eat so that way you can burn it. So you need a balance of this anabolic, which is building, and catabolic, which is breaking down. So the cells do need to be able to break down, and they do kind of help one another. The cells get better when they are in this breakdown phase. So diminishing returns, if you have too much insulin, the cells just stop responding to the insulin. So 88% of adults have insulin resistance. So the high insulin, so the more insulin you have, the more resistant you're going to be to it. So we need to try to turn down this volume. And to get an idea of how insulin's working, is like the more exposure you have, the more resistant you're going to be. So just like getting a vaccine, everyone's getting vaccinated nowadays. When you get a vaccine, that you're more resistant to the virus. So the exposure causes you to be able to respond, be resistant to the virus. So the cells aren't going to respond. Or another example would be alcohol. You first take a drink. I don't drink very much, so if I drink a little bit, I get tipsy quite easily. But someone else who drinks all the time, it's going to take them more alcohol to get the same effect. So more resistance. Here it is again. So insulin controls your blood sugar. Every time you eat, you have your glucose goes up, your insulin goes up. It stops your fat from burning. So the more you eat, the less fat burning you're going to get. Insulin keeps your energy stable. Insulin is an anabolic hormone. and it does help store fat. It does protect against too much blood sugar, so ketoacidosis. Insulin resistance. So I got into this type of work because of, I'm a regenerative medicine doctor. I started off my career as a physical therapist, did a lot of orthopedics, treating a lot of joint pain. That led me into working with hormones, and through working with hormones, learning more about insulin, which is a hormone, and how it has a really great impact on inflammation. So when we have more inflammation, especially if we're overweight, we're going to tend to have more inflammation in the body. And my goal is to help my patients feel better, have less inflammation. And so by helping you lose weight, become less insulin resistant, it's going to help your overall health. So women, when they have too much insulin, they're going to have high testosterone. So yesterday I had a patient, she has diabetes. Her testosterone was over 1,000. So that's very high for women. I'm looking mostly for women, between 1 and 300 is, definitely the most that you need. Estrogen is going to increase, too much insulin is going to increase estrogen in men. So they're going to get, more like man boobs, just more estrogen effects, less libido, things like that, erectile dysfunction. Insulin does have an effect on blood pressure. So people always say blood pressure is a silent disease. Well, what they're finding now more and more is that it's the insulin that has an effect on the blood pressure. And so too much insulin will cause the blood pressure, the arteries to constrict. It won't allow them to relax. It does affect your liver, so we can get fatty liver. So that's not good. It causes high cholesterol, and it can affect our neurotransmitters and how we feel in our brain. So the more insulin you have, the fatter you're going to get, the sicker you become, and the sooner you'll die. I love that quote. So it really kind of gets to the point that having high insulin is really not the best thing. What we want to do is try to reduce that insulin resistance. When we have high insulin, your risk for heart disease, Alzheimer's disease, cancer, and stroke all go up. Your inflammation, I see it all the time because I put people on a lower carbohydrate diet when they have a lot of joint pain, and their joint pains will go away. So diet has a lot to do with inflammation, and the insulin resistance is what's causing the inflammation. Everyone is unique. So just because your blood sugar is normal doesn't mean that your insulin response is normal. So people become diabetic when their body's not able to respond to their insulin's not able to get the blood sugar out of the body. And so that's when you become diabetic, the insulin resistance has kind of tipped over the edge. And so we can take the same person, me and you, or whoever, two people, could be the same weight, they're going to have a different insulin response. So it depends on how often you're eating and things like that. And just because you're not overweight, if you have a high insulin, sometimes that can happen, then you're going to have a more increased risk for still those other diseases that we just talked about, Alzheimer's disease, heart disease. When your insulin is high, you have the risk. But different people have different insulin response. So if we both ate a piece of bread, which I'm not recommending, but if we all ate a piece of bread that has a glycemic index of 100, and so we can have a different insulin response. So my insulin response might be, say, 1 or 2, and yours may be 3 or 4, or vice versa. So everyone's a little bit different as far as how much insulin gets secreted with what we're eating. And even though the blood sugar is normal, and I really like this idea because you could have normal blood sugar, but your insulin response is different. And this is why I've been testing insulin more and more. I have a patient I saw yesterday. She keeps gaining weight. Her blood sugar is normal. I said, well, we really probably should check your insulin levels because you can have normal blood sugar, but high insulin, and that's what's causing the weight. So it's really important to get your insulin levels checked. So we gained weight. So insulin really is the quarterback to gaining weight. It's the kind of like causes you to store fat. So as your blood sugar goes up, that's going to be the first thing that happens. And then after that, the insulin's going to go up. When your insulin is high, that causes you to store fat. When you store more fat, that's going to cause you weight gain. The more carbohydrates you eat, the more insulin you're going to get and the more storage you're going to get. So we really want to I would like to, encourage you to eat a lower processed carb diet. And the high insulins are causing insulin resistance. And over time, the more insulin resistance you have, the higher the insulin you're going to get, and then you're going to get more of the health problems. It seems more and more that these health problems are more related to insulin rather than blood sugar. What we found is that some of my patients, they come in and they're on blood sugar medications that increase their insulin. They're getting fatter and sicker because it's the insulin that, we don't want to keep giving insulin. We want to lower the insulin. So the key is to keep that insulin lower. So the more fattening carbohydrates, so this is from Dr. Jason Fung. He has this hormonal obesity theory. So the more carbohydrates that you have causes your insulin levels to go up. When your insulin goes up, you're going to reset your body weight, and you're going to get obese, and you're going to be eating too much and exercising too little. And so insulin resistance, again, is time dependent. So it's not like one time, but it is over time that you become insulin resistant. So what should we eat? So the fattening carbohydrates, again, sugars, processed flours, processed pastas, these types of things have a very high insulin response. The more a food is processed, the less fiber is in it per se, and the more rapidly absorbed it is, and then the insulin has to respond higher. So the refined carbohydrates will give us fatty liver. Bread is refined. I thought this was very interesting as well. Bread has no essential nutrients. Bread is very processed, so for it to have any essential nutrition, they have to add it back in. There's no essential carbohydrates, so we have essential protein, essential amino acids. We have essential fatty acids, but we do not have any essential carbohydrates, which is very interesting. So what should you eat? You should eat a whole diet, unrefined, unprocessed foods is really best. Avoid flours, sugar, starches. Really avoid the refined oils, the soy oils, the canola oils. I really recommend my patients use olive oil, avocado oil, these types of things. Butter is okay. Avoiding the processed meats. These processed meats really aren't very good for us at all. Artificial sweeteners. What we found is that artificial sweeteners, 0 calorie, still increases your insulin levels. So that's, I find, to be quite interesting. Something could be 0 calorie, but could still stimulate your insulin levels. And carbs. So you want to eat your carbs with fiber. So what happens is when we eat carbs naturally, all the carbohydrates, say like vegetables, they come with fiber, apples, carrots, there's normal fiber in there. And that's the way nature intended it to be. So the more carbohydrates, natural vegetables and such, you want to eat them with their fiber. So refined carbs are addictive. And so they're hard to stop. People do get addicted to chocolates and cookies and pastas and breads. I mean, I could eat a whole loaf of bread. I could eat a whole pound of pasta, no problem, because it's refined. It just doesn't really give you any satiation. And a lot of these candies have a lot of high fructose corn syrup, which is very bad for us. And I'm not going to go into fructose today, but fructose is much worse than sugar itself. Again, these things are addictive, the processed foods. No one really gets addicted to fish. No one gets addicted to beef or apples or spinach or anything that's natural, because they're normally very satiating on their own. So again, I'd like to encourage you to eat whole foods. It's very difficult to overeat these whole foods. Very easy to overeat these processed carbs. As good as they are, I'm not saying you can never have them again or anything like that, but I do think that if you're trying to lose weight, we want to lower that insulin response, and the carbohydrates, especially the processed carbs, really increase your insulin quite a bit. So here I do offer these what's called metabolic boost injections. These metabolic boost injections, they're not miracle drugs. They're called, I have an injection, it's called, we're doing lipostat, and now we're doing lipomino. So it's a little bit more B vitamins, and it also has amino acids. And so they do help to process carbs, helps you burn more calorie, burn more carbohydrates, burn more energy. You definitely need to follow a good diet. If you're just wanting to do the shots and lose weight without cutting back on the carbs, it's not going to work. And we're having very good success with this program. Yesterday when we were talking, one of the gals was mentioning that she lost over 35 pounds, and her hemoglobin A1C is now normal, which is a measure of diabetes, which is great. These lipomino shots, they work. They do help increase your metabolism. They do help decreasing appetite. They have some inositol in there that has a little bit of calming effect. So it's kind of like a calming, but also energy at the same time. And we're getting pretty good results. If you're interested in that, you can call us at the office and we'll give you some information on how to get you started with that. So next week, we'll be talking about insulin, more about insulin and how it's affecting us. We're going to be talking a lot about fasting, intermittent fasting. There's all different types of fasting methods. What I like to encourage people is to kind of, fasting is kind of like a skill that you have to develop over time. And so it's not like you're just, fast for, 2 or 3 days to start. Usually people talk about like a 16-8 or 18-6 where you're fasting maybe 16 hours, or even just skipping breakfast as a fast. And so that's oftentimes what people will do is skip breakfast. People ask me, what can I do over the next week? I would say, let's just start looking at what you're eating and how you can make some changes in your diet, how you can get out some of these processed carbs from the diet. It's going to be really helpful for you, for your health, to help lowering that insulin response. If you haven't had your blood work done, I'd love to check your insulin levels, your hormone levels in general. In a couple of weeks, we're going to be talking about hormones and weight loss. There's a lot of little keys to helping optimize your health through insulin, and also other ways to optimize your hormones, because a lot of women, especially when they go through menopause, the loss of estrogen can also cause increased weight gain because it's of the insulin assistance. So all the hormones work together. It's really a symphony of hormones working together to help keep your body in balance. So I'm very excited to have this talk with you today. If you have any questions, please let me know. I'd love to see you. If you need any blood work, let me know. If you're interested in the metabolic boost shots, let us know. There's our phone number there. You can just give us a call. And if you haven't had any blood work done in the last 6 months, I do require that anyone that does the shots have some blood work. It's real important. So be well. If there's anything I can do for you, let me know, and I'll talk to you soon. Thanks so much, and have a beautiful day.